Organ relationships, lung and kidney, liver and spleen. The lung and the kidney. The key points to note: the physiological relationships. Respiratory movement. The lung governs respiration while the kidney governs qi reception. Fluid metabolism. The lung regulates the water passage while the kidney governs the fluid. Lung and kidney yin nourish each other. The relationships between the lung and kidney are mainly manifested as mutual dependence in respiratory movement, water metabolism, and yin generation. Physiologically, the lung is the upper source of water and the kidney governs the water. On the other hand, the lung transmits the water downward to kidney by diffusion and descent of lung qi. On the other hand, the diffusion and descent functions of the lung qi depend upon the transforming and steaming functions of kidney yang. The lung and kidney act on each other to maintain the normal process of water metabolism. In regards to respiratory movement, the lung controls respiration and governs the qi, while the kidney stores essence and governs reception of qi. Respiratory movement is governed by the lung, but the lung's function of controlling respiration needs assistance by the kidney's function of reception of qi. Therefore, the body can keep the depth of inspiration and secure the harmony of respiratory movement. In addition, lung yin and kidney yin promote each other. Kidney yin is the root of every organ. Therefore, the lung yin depends upon the nourishment of kidney yin. The relationships between the lung and kidney are similar to the relationships of mother-son, according to the theory of the 5 elements. The lung fluid helps the kidney yin. They promote each other to keep the sufficiency and balance between them. According to TCM theory, it is called the mutual promotion of metal and water. Pathologically, disorder of the lung and kidney functions will cause disturbance in water metabolism, which will result in symptoms like oliguria, edema, cough, asthma, and phlegm. If both lung and kidney qi are deficient, it will disturb respiratory movement, resulting in shortness of breath and frequent dyspnea. Yin deficiency of both lung and kidney will cause symptoms of dry cough, tidal fever, and lower back soreness. The liver and the spleen. The key points. The physiological relationship is in digestion, the liver governs the free flow of qi, while the spleen governs transportation and transformation. Blood circulation, the liver stores blood while the spleen controls blood. The relationships between the liver and the spleen are manifested in 2 aspects. One is the interdependence of qi free flowing, as well as the transformation and transportation, and the other is the coordination of blood storing and blood controlling. As for digestion, the liver governs free flow of qi, while the spleen governs transportation and transformation. The liver governs free flow of qi, regulates qi dynamic, promotes the bile, and improves the transforming and transporting functions of spleen and stomach. Therefore, the liver governing the free flow of qi is the foundation of a healthy transporting function of the spleen. The liver stores the blood, while the spleen is a source of qi and blood, as well as controls the blood. When the spleen qi is abundant, the blood will be sufficient, and then the liver can store it. The liver and spleen cooperate with each other to prevent blood loss, as well as to promote the movement of qi and blood. If the liver fails in governing flow of qi, it will lead to failure of the spleen in transportation and transformation. There will appear the syndromes of disharmony between the liver and spleen with symptoms like chest fullness, poor appetite, abdominal distension, and diarrhea. If deficient spleen cannot produce or control the blood, it will cause bleeding, which leads to the insufficiency of liver blood. If the liver cannot store the blood or the spleen cannot control the blood will escape from the vessels with symptoms like menorrhea and uterine bleeding. Thank you for your attention.